Anderson, performance and longevity.
Dr. Brian Anderson here. Hope that you're having a great day. Today we're going to go over how to perform a testosterone injection. So check out the video. Please give our office a call if you have any questions. Have a great day. Okay, so these are the supplies that you're going to need to do the testosterone injection. Again, you have the needle, syringe, the 18 gauge needle, and the testosterone medication. Step one, you're going to take your alcohol wipe, get that out, and you can get these. This should come in your kit, or you can get them at CVS, Walgreens, etc. You're going to swab the top of the bottle, like so. You're going to allow that to dry. In the meantime, I'm going to switch the syringe from the needle that you inject with to the 18 gauge needle. And the reason for this is if you try to use the small needle, it's going to take a long time for you to draw the medication up. So you're simply attaching the 18 gauge needle. There's a little bit of air in the syringe, which is what you want because there's a vacuum in the bottle. Simply going to put the needle in, push the air in slowly to get rid of the vacuum, and then we're going to draw the medication into the vial. So in this case, we're drawing up 1 cc, again, to the 1 mark. See, there's an air bubble in there, so this is actually good because we want to get the air bubble out, so sometimes we need to being a little finicky. We'll go a little above the 1. We're going to turn the needle up, click it a few times, and then do that. We're going to pull back because we don't want to lose the medication. So we're pulling the medication out of the needle. We're going to be careful and recap the needle. And then we're going to attach the syringe to the smaller needle. In this case, this is a 27 gauge, which is what we typically use. And we're going to attach, and we are going to go to step 2. So now we're going to go over where to inject. You can inject in the quadricep, or the glute, or the deltoid, depending. I find that most people say the injecting in the glute is the least painful, followed by the deltoid, followed by the quadricep. The quadricep is the easiest place, however, to inject yourself. So let's go over where to inject in the quad, okay? So first off, let's say the top of the quad here is the 12 o'clock position, and over here we have 9, and over here we have 3. You want to inject somewhere between 9 o'clock and 12 o'clock, okay? So what I'm saying, you want to inject in the outer part of the thigh. We do not ever want to inject in the inside or the medial part of the thigh, because this is where the femoral vein, femoral artery, nerve, etc. You do not want to inject into an artery, ever. So what you're going to do is go to the proximal quad on the outside, okay? So somewhere between, again, 9 and 12, and you're going to prep the skin area with an alcohol swab. Again, you need to let the alcohol dry for 20 to 30 seconds so that you kill bacteria that are on the skin. If you're in the gym, if you're sweaty, you might want to do this twice. Again, you do not want to get an infection. Then you're going to take the needle, you're going to uncap it, and then go into the quad area at about an angle like this, okay? So not a steep angle, you're going to go perpendicular to the skin, the area that you're injecting. You don't want to go into the iliotibial band either, okay? So about here is where you would go. So you're going to prep the area, uncap the needle, put the needle in the skin. The faster you get it in the skin, believe it or not, the less painful it is. So you're going to put the needles as an 1.5-inch needle. You're going to take the whole needle and you want to put the entire needle into the skin. So you don't want to put part of it in. You're going to put the entire needle so it's into the muscle. And that should, believe it, the most discomforting part of doing the injection is actually when the needle touches the skin. So after the needle is in there, pushing it in further is not really going to cause you more discomfort, okay? So you're going to put the needle in all the way. You're going to draw back on the plunger, okay? And you want to make sure there's no blood in the plunger. If there's blood, you need to remove the needle and start over because you were in a vessel. So you're going to aspirate, make sure there's no blood. and they're going to slowly inject. The slower you inject, the less painful the injection will be. If you slam it home, you're going to experience more discomfort as if you put the medication in over a period of maybe 3 to 5 minutes. After the medication's completely, all of it is in, you can see by there'll be no medication left. You're simply going to pull the needle out, be careful and recap it, and put this into a sharps container for disposal.
Anderson, performance and longevity.